Live from the body with Vaibavee
and Dr. Sinziana. Hi everyone, my name is Dr. Sinziana. I work at UMCG as a nephrologist, and today I'm going to be talking about how drugs are excreted from our bodies. Now, giving over to Vaibavee on field for an interview with the liver.
Hello everyone, we have the liver in the studio today. Hi liver, how are you?
Doing good, absolutely.
Okay, that's nice to know. Can you tell us a little bit more about yourself as an organ?
Of course, I am one of the largest and busiest organs in the body. People think it's the brain, but we work a whole lot more. We process nutrients and we detoxify chemicals, and I also make bile.
Oh, that's a lot. Do you want to add something else to the list?
Well, I also play a part in excretion.
Oh, that's a lot of things going at once. But then, can you describe me a situation where you have a little more workload on the day?
Well, when my owner drinks a lot, it overwhelms me.
Oh, that's nice to know. Now, to know more about the anatomy and the physiology of the liver, which is the busiest organ of our body, I'm giving over to Susie. Susie, here you go.
The liver plays an important role in metabolizing drugs or breaking them into smaller parts, also known as metabolites. These metabolites can be excreted. When they cannot be easily excreted by the kidneys, hepatocytes, or the cells that make up our livers, secrete them into bile. Bile is a yellow-green fluid that contains bile acids, bilirubin, cholesterol, electrolytes, and water. Besides fat digestion, one of the other roles of bile is to carry drug metabolites to the intestines for further processing and excretion into the feces. Now, giving over to Vaibavee for the interview, and thank you for your attention.
Hi Colin, how are you?
Doing good, thank you.
Okay, it's very good to have you here. Could you tell a little bit more about yourself to us?
Thank you for having me. Well, I'm basically the body's recycling and waste disposal department. I take whatever's left after the small intestine absorb all the nutrients, and then I extract all of the water and electrolytes, and then I compact it into a solid waste, and I store it and wait until it's time for a bathroom break. Hey, it's a dirty job, but somebody's gotta do it.
Well, thank you so much, Colin. Now, for the scientific part, giving over to Dr. Susie.
Now, thank you, Vaibavee, and we're going to be moving on to the next organ. Fecal excretion eliminates drugs that remain unabsorbed in the gastrointestinal tract or are excreted into bile. Though not a major elimination route, it can be important for some weak bases that passively diffuse from the capillaries to the intestinal lumen. Drugs eliminated this way bypass enterohepatic recycling and are often characterized by low oral bioavailability. Examples include vancomycin, administered in the oral form, barium sulfate for gastrointestinal imaging, iron supplements, noted for the dark color stool, and lomitapide, a lipid-lowering agent metabolized primarily in the liver. Now, for the next organ, giving over to Vaibavee in the field for an interview with the kidneys.
Hi everybody, we have the kidneys, body's natural filtering expert. Hi kidneys, how are you?
I'm good, thank you for having me here.
Well, kidney, welcome to the show. And do you want to explain what your regular roles are in a body?
Thank you for asking. So you might not see it here, but we are two of us, my identical twin and I. So we basically keep your body clean, we balance electrolytes, and we remove the waste toxic substances, and we also control your blood pressure. So you can think of us as your personal inbuilt filtration system.
That's nice to know. It looks like you have a lot going on. You have multiple tasks to juggle. Can you describe a situation where if you don't work for, say, a day, what would happen?
Oh, that would be disastrous. Waste and toxins would start building up, your electrolytes, the electrolyte balance will be thrown off, and your blood pressure will go haywire. So, yeah.
Okay, so that means that one day without kidney would be almost the last of your days living. So, now to understand the anatomy and physiology of this, I'm passing over to Dr. Susie. Susie, are you there?
Thank you, Vaibavee, for the lovely interview. And now we're going to dive into the anatomy and the physiology of the kidneys. Well, kidneys are the filter of our bodies. They decide what goes back into the bloodstream via reabsorption into the renal vein and what goes out via excretion into the urine. Their functional unit is the nephron, which consists of a collection of capillaries that ensure blood filtration and are also termed the glomerulus. And they perform the first step in urine formation. This glomerulus is enclosed by a cup-like sac called the glomerular capsule, blood is supplied to the glomerulus by an afferent arteriole, whereas blood exits by an efferent arteriole. A long tubular structure split into several parts with distinct functions connects the glomerulus and its capsule to the collecting duct, which drains renal filtrate. The proximal convoluted tubule, or PCT, is important for reabsorption of glucose, amino acids, and peptides from the filtrate. Water and sodium chloride reabsorption occurs in the loop of Henle, more specifically, water in the descending part and sodium chloride in the ascending part. Some reabsorption and secretion still occurs in the distal tubule or distal convoluted tubule, yet less than in PCT. Thus, its main function is iron reabsorption and potassium excretion. Now, let's imagine what happens when a drug metabolite reaches the kidneys. Well, the first stop is of course the glomerulus, where we already know that filtration takes place. The efficiency of this process across all nephrons per minute is measured via GFR, or glomerular filtration rate. In the PCT, a process called active secretion increases the drug concentration as drug metabolites are transferred from the peritubular capillaries into the tube's lumen. Following filtration, drugs can either be actively or passively reabsorbed back into the blood from tubular lumen and thus increase their half-life. Antibiotics such as vancomycin and penicillin, along with lithium salts used to treat psychiatric disorders, are only a few examples of drugs that are excreted renally. Now, giving over to Vaibavee, who's going to interview a UMCG patient, and we're going to find out how it really feels in real life when you cannot metabolize drugs properly.
Hello everyone, I'm Vaibavee in UMCG interviewing Mrs. Gray. Mrs. Gray, how are you doing today?
Well, I feel like not very good right now. I'm in the hospital, so that's not great actually.
I'm so sorry to hear that, but thank you so much for having this interview with us today. So can you describe why you're here today in the hospital?
Well, I'm not quite sure. I was just not feeling great, so my husband and I came to the hospital. The nurses and the doctors say that there is stuff wrong with my kidneys, my intestines, and my liver. So it has something to do with drugs or something, but yeah, it feels very strange.
That sounds like a stressful thing to go through. So do you know how often your prescription drugs are changed on a daily basis?
I mean, it feels like every minute at this point. I don't really know what's going on, but yeah, the nurses keep fumbling with things at the IV pole and give me tablets, but it's supposed to work, so I'll just go along with it.
It sounds like you're going through a very stressful period. I'm so sorry to hear that. Now, for more information on aging and excretion, I'm passing on to our studio. Dr. Susie, take over. Thank you.
Thank you, Vaibavee. Now, aging affects drug clearance in the kidneys, liver, and intestines, each of which playing a role in drug excretion. Reduced glomerular filtration rate in the kidneys slows drug clearance, prolonging drug action and increasing the risk of accumulation and toxicity. This often requires dose adjustments, particularly lower doses to avoid nephrotoxicity. In the liver, aging reduces hepatic blood flow by 20 to 50% and decreases bile production and flow, impacting metabolism and bile excretion. Drugs eliminated in bile may thus have prolonged effects, sometimes necessitating dose adjustments. In the intestines, age-related declines in gastrointestinal motility slow transit times and may disrupt absorption and excretion, especially for drugs undergoing enterohepatic recycling. Additionally, shifts in gut motility and microbial population can result in inconsistent absorption and excretion, affecting drugs that rely on fecal elimination or bile. Thank you so much for watching. This was Live from Inside the Body, and this episode was about excretion. Tune in tomorrow morning at 6:30 to find out more about how drugs are metabolized inside of our bodies.
I also wasted. I'm so.
Hi.
It's fine.
Yeah.
This is also good. Okay. How are you doing today?
It's Mrs. Gray, but
And yeah. No, sorry, can you go again?
And we process. I can't remember.
Wait, but we have to stand more in the middle. Where is the...
Well, you might not see us, but
I need to ask the
Okay, do you know what you're gonna say?
Yeah.
although it's not very nice to be.